We're just letting it. All right. Welcome to our early childhood grand rounds session focused on Act 76. This meeting is also serving as the Vermont Early Childhood State Advisory Council meeting for March. So we're excited to see all of you here. We had over 120 folks register, so we're actively letting folks in, and it will be recorded today. I'm the Executive Director of Building Bright Futures, Morgan Crossman, which is, as we think about the role of Building Bright Futures, we serve as the Early Childhood State Advisory Council and the Early Childhood Data and Policy Center. For those of you who are just joining us for the first time, the State Advisory Council Network serves as the primary advisor to Vermont's governor and the legislature on behalf of kids and families prenatal to age 8. We serve as a public-private partnership and really focus on leading the strategic plan and vision for the state for the early childhood system. And within that role, we serve as a nonpartisan independent source of data to monitor the system on the state's behalf and centralize data to inform decision-making and support that accountability. As an early childhood network, we've worked really hard with public and private partners to build a collaborative vision and strategy for how we think about supporting data-driven decision-making. And at the most simple level, for folks to be aware of what that vision is, it's to support the state's collective understanding of young children's experiences with services, child and family outcomes, and the system of services across sectors. It's about enhancing the visibility and accessibility of child development and early childhood systems data. And then most importantly, it's translating that data into programmatic and policy decisions and supporting our decision makers in that way. Early childhood grand rounds, if this is your first time attending one of our sessions, is one of the key convening mechanisms that BBF uses to elevate and disseminate high quality data and data related topics that impact Vermont's early childhood sector. We might be talking about data challenges facing our state, national best practice, or bringing together experts to have intense conversations about where we are and what's on the forefront. I'm really excited to be here this afternoon with a range of experts in a panel talking about Act 76, and want to just do some brief logistics with folks today because we are not going to run the session as a webinar. We want there to be a ton of interaction with partners. So for those of you who are attending today, until we get to the discussion portion, we're going to ask you to turn your cameras off and make sure that you're muted, and we'll invite you back into the space once we start the discussion section. We also want to ask that you introduce yourself in the chat. So your name, your role, your organization, if you are a family member of a child under the age of 8, and where you live. In terms of the structure of today's Grand Round seminar, the first 50-ish minutes is going to be 10-minute works in progress presentations from 4 of our key partners. So you're going to hear partners introduce themselves and their organization. You'll also hear about their current work related to Act 76 or their contribution to progress in the childcare and early childhood education system as we've looked at significant investment through Act 76. In the last 20 minutes, the hope is that we'll have time for questions and answers with participants. We're not going to do questions during the presentations, but I'm asking you, as you are hearing panelists speak, put your questions in the chat bar, and then we'll capture them and be bringing them back into the space. You'll also have the ability to raise your hand once we get to that discussion question section. A couple of last logistics. The first is that as you're thinking about continuous education credits for today's seminar, you can email data@buildingbrightfutures.org. We're really excited to be able to offer that. So for those of you who included your BFIS number in your Zoom registration, it's handled on your behalf. And lastly, we just want to honor the fact that we were not able to do this session at night or on the weekend, and we will absolutely record and share this with partners who couldn't be there, especially those who are direct service providers who are actively working with kids. So we're working on doing that at various times in the future. And I am also home with a sick child. So if you have not yet heard my assistant, I have a 7-year-old that is actively participating. In terms of today's session and why we're focusing on Act 76, one of the most important things that has happened over the last few years is that Vermont has made really bold change and led the country in supporting this historic child care bill through Act 76. We've also seen some really significant changes over the last 10 years in thinking about supporting and integrating services for children with disabilities and special healthcare needs, adopting universal pre-kindergarten education in a mixed delivery model for threes and fours, and then this most recent investment in improving high quality, affordable, and accessible childcare and early childhood education. So what you're going to expect to hear today from our panelists is an outline of system-wide data, successes, ongoing challenges, and then collaborative efforts on behalf of those partner organizations. One of the really exciting pieces of this law that has not necessarily been done in the past is that Vermont's leaned into data-driven policy in a really important way and hopes to serve as a model for other states across the country for government accountability. So a quick thank you and shout out to our legislative leaders who have absolutely shown their commitment to government accountability and monitoring the impact of this law. Specific to Building Bright Futures role, we were named within that legislation as the entity that's responsible for convening partners, collectively defining and measuring success, and then supporting and building capacity of agencies in that government accountability space to support data-driven decision-making. In the first year after this law passed, Building Bright Futures ran a 6-month partner engagement process to say to the state, what do you care about? What is the most important thing to measure that would tell us success and impact of this law? And how do we think about that over the next 5 to 10 years? So we utilize our public and private partnership, many of you in the room today, to actually say, okay, what are those indicators? What should we be measuring? And how should we be thinking about this law? We've worked really closely with the panelists, namely the Child Development Division and others, to say, what do we have of that existing data and how do we compile that so that we can show our starting point and then also progress since that legislation has passed to monitor change over time. At this point, we've submitted 2 formal reports to the legislature. There have been a range of partners who have testified within the legislature, namely in the House Human Services Committee. And in terms of what's next on the monitoring side, we're developing a data portal through the Early Childhood Data and Policy Center to centralize the quantitative data that you'll hear about today to make it publicly available and searchable. And then we're also working with the partners on the call today that are going to be presenting to develop stronger mechanisms to monitor this data collectively over the next 10 years to really look at the impact of the investment on children, on families, on educators, on the system, but also the economy. Lastly, in terms of kind of this broader overview and introduction, I want to name the importance of partnerships in thinking about monitoring. So even though Building Bright Futures was named as the entity responsible for monitoring, we're bringing together partners across the state in public and private domains on a consistent monthly basis to talk about the work and what the needs are on behalf of kids and families. Related to Act 76, we wanted to spend a little bit of time articulating some of the roles of these key system level partners that are actually executing and implementing and monitoring Act 76, as well as broader components within the early childhood system. So this afternoon, you're going to hear from Deputy Commissioner Janet McLaughlin from the Department for Children and Families Child Development Division, and she will definitely be talking about the implementation and the work of her team in partnership with others to say, okay, how do we move from a law passing to implementing and where are we now? You'll hear from Sarah Amadon and Kate Stepper from Child Trends, and they are our national data experts that are coming in to build state capacity in actually monitoring from a quantitative and qualitative perspective what we know about these changes. You'll hear from Sharon Harrington, who's the executive director of the Vermont Association for the Education of Young Children, largely about their role in thinking about early childhood education workforce. And lastly, you'll hear from Erin Roach, who is the executive director of First Children's Finance, and their role really thinking about childcare businesses and, again, broader monitoring components. I also want to recognize that there are so many other partners that are not part of this panel today that are playing incredibly strong roles, both in the passage of Act 76, ongoing advocacy, implementation, and monitoring. Some of those are childcare programs themselves, Vermont After School, the Agency of Education, the Department of Labor and Taxes, Childcare Resource and Referral, and eligibility specialists. And then a special shout out to our partners at Let's Grow Kids, who have done so much work to lay the groundwork, not just on the advocacy and the passage of this legislation, but supporting the field as well as the data work, and are working together behind the scenes in strong partnership. So as we move into our panel for today, again, here is what I'd like you to be thinking about and looking for from our presenters. And again, please pose questions in the chat as we move forward. First, you should expect to hear about the significance of this work and what's happening on the ground right now and over the past year and a half in Vermont and how that's situated within the national context. I want you to hear about successes and challenges within implementation, where we are now and where we're headed. And then on the data trend side, what are we seeing right now across some of the key indicators, namely around capacity and workforce, family experiences, and CCFAP enrollment. So I'm going to take my video off. We're going to start with Deputy Commissioner Janet McLaughlin to give her overview. And Janet, let me know if you have any tech issues, but we can move forward with screen sharing.
Okay. Wonderful. Okay. Hi, everyone. Again, Janet McLaughlin, Deputy Commissioner, the Department for Children and Families, overseeing the Child Development Division. The Child Development Division really oversees sort of all things childcare. We oversee Children's Integrated Services, which really focuses on supports and services for our youngest children who may need some extra support to make sure that they're hitting all of their developmental milestones and are supported, as they grow in both their home and any community-based settings they're in. And we also co-administer universal pre-kindergarten along with our partners at the Agency of Education. And I am really delighted to spend some time talking with you today. We, as Morgan mentioned, Vermont really has been a leader in for early childhood education and school-age childcare for quite a while. But the changes kind of in the last, 18, 21 months have really placed Vermont on the leading edge in terms of what's happening in terms of supporting children when they're enrolled in childcare programs in early childhood or after school settings, supporting their parents, supporting the professionals who work in those programs, and really supporting our communities and our economy overall. That is sort of wide scope of reasons are sort of why the governor and the administration has been really supportive of and focused on childcare. And this law is something that, the Child Development Division has been working really, really hard to implement since it passed. We're really grateful to have a whole ecosystem of partners that, got us to that point and then are supporting making sure that these investments are getting to where they should. So we can go to the next slide. So here's my summary of Act 76. It is a multifaceted piece of legislation, many, many components to it. But the biggest picture, right, is it passed in June 2023, and it more than doubled the state's investment in childcare. And those changes, focused on affordability. Like the Child Care Financial Assistance Program or Child Care Subsidy was the primary vehicle. And so the bulk of my slides are going to focus on some of those changes related to that program. It focused on quality. We recognized the importance of quality to get the return on investment that everybody was looking for. And so there were efforts to support. So the law includes supports for quality improvement, supports for capacity development, and supports to make sure that programs are able to, include the full range of children that we find in our communities as well. So there's affordability, quality, access, right, is also that capacity building, both creating new spaces and also new programs altogether. And then funding, obviously, this is what really was unlocking it all. If people remember, as the bill was being passed, the governor had proposed a really significant investment from the general fund. The legislature added onto it payroll tax. And it's a 0.44% payroll tax that is shared between employers and employees, and it goes into a child care contribution special fund. The payroll tax started in July of 2024. Our partners at the Department of Tax did their job. They got it going and got it collected at the right time. It takes a while to get that stood up, but we're seeing the funding come into that special fund at this point. There were elements of the bill that really focused on accountability and administration and monitoring of those resources for implementation, and that's part of what Morgan was looking at. And then there was also a significant section of the bill that was targeted towards pre-kindergarten. And I'll touch briefly on the pre-kindergarten pieces as well. But that because pre-kindergarten is part of the broader public education system, the changes there are really interwoven with the public discussion around our education system as a whole right now. But when this bill passed, really the Child Development Division team just immediately got to work. We had, changes we needed to make within weeks to childcare financial assistance. We needed to do public engagement, set up partnerships. We really focused on communication and making sure that our community of folks who are working on everything that sort of touched Act 76 were well informed, that they could find the information that they needed. And just as I launch in, I do want to emphasize that I think one of the keys to successful implementation for this law happened before it even passed. When the administration and the legislature worked closely together, during the bill writing process to include really staggered and achievable implementation dates associated with some of these major elements. Let's see. Okay, next slide. Okay, the pre-K committee. It was, and I'll touch briefly on it. This slide is just like high-level information. We got the pre-K committee started right away. It was chaired by myself and the leader at Agency of Education at the time. And, we submitted 2 reports, and there was a webpage that has an incredible amount of information. This committee, of course, was challenged by the fact that the public education financing environment really changed significantly while we were in the process. We also had to do a lot of education on the committee because pre-kindergarten is a program that's implemented in a mixed delivery manner, and had been around for 10 years with lots of partners, but without a lot of information had been compiled. And so the committee really did some of that work. And if you want to go to the next slide. We ended up with really 4 foundational recommendations as the pre-K committee. But I really encourage people to take a look, who are interested, to take a look at the full report. But ultimately, the recommendations were to maintain at least the 10-hour-a-week pre-kindergarten benefit for both 3-year-olds and 4-year-olds. The initial Act 76 asked us to consider removing 3-year-olds, and really the committee was pretty unanimous in their sense that we didn't want to expand for 4-year-olds at the expense of 3-year-olds. And that would have wasn't going to meet the needs of our kids and communities. And so that was a very strong recommendation. But there was a recommendation that we do want to expand pre-kindergarten, and we should start with 4-year-olds. And then the final 2 recommendations here have to do with the funding. So there is there was just a recognition that we need to do more analysis of the way that pre-kindergarten slots are paid, as well as a different methodology for paying for pre-kindergarten spaces in non-school operated programs. And again, this has been really wrapped into the education transformation discussion. And the work of this committee is a really important input into the pre-kindergarten elements of that discussion. We can go to the next slide. Okay, so as I said earlier, the Child Care Financial Assistance Program really is the primary vehicle for Act 76 investments. And there's 2 things that are working in tandem that I think are really important for people to keep in mind. So one is that we increased rates paid to childcare providers on behalf of families. And the second is that we increased the income eligibility for families from 350% of the federal poverty level to 575% of the federal poverty level. And that makes Vermont's program by far the most financially inclusive childcare subsidy program in the nation. It's really, we're leaps and bounds in front of other states. I think the closest other state is at 400% of the federal poverty level. So if you want to go to the next slide, I'll go into a little more detail. So in terms of rates, there were multiple ways that the rates were increased. And again, we had to do some of this right away, right? Again, the bill passed in late June of 2023. And by early July, we had adjusted the rate structure for childcare financial assistance to increase the base rates across the board. We also just increased childcare, and then that was sort of in July, and then in January or December we increased another time, and then last spring in June of 24 we increased even more for family childcare homes. And so what that means is that the increases range between 35% and up to 120% in terms of the rates the state was paying on behalf of families based on the program type and the quality level. Now, and the intention there is to make sure that all programs have the resources to offer high quality childcare. Okay. So we can go to the next slide. Then there was the expansion for eligibility. So there's this giant expansion of income eligibility. And again, now we're at a place where we actually just had, as of this weekend, had an update for the 2025 federal poverty level. But for now, an example would be a family of 4 that had an approved service need and a gross income of up to $184,000 could now be eligible for some support paying for childcare. So it really, again, it really can cover, a significant portion of families with young children in Vermont. A thing to remember is those families at the top end of the income scale still have a significant copay. They're still paying 10, 11, 12% of their income on childcare, over $20,000 a year. But when that might be compared to $45,000 if the family had more than one child, it really is a really significant contribution. And then we've also been focused on some of the other eligibility requirements to make sure that we're really able to serve all children who would and families who qualify and would benefit from the program, and that include making the program more accessible for families that are new to Vermont, new to the United States often. We've launched an online application at last. That was exciting. And we're seeing that about 33% of the applications that are processed are coming in through that system. We expanded the education service need, and we have a refined self-employment policy coming up. So you can go to the next slide. Okay, so we've made all those changes, right? So the question is what happened? Did it work? And that's going to be a lot of what you hear from the other panelists. But I will share this with you from a financial perspective, is that we are sending out, dramatically more money now than we used to. And that really is making things more affordable for families and is really shoring up the community of programs that receive childcare financial assistance subsidy. This, I think, maybe these dollars are in millions, so it's 180 million at the top here. But you can see how much, and sorry, my slide didn't translate all the way. So you can just see dramatically how much is increased. And so for this fiscal year, where it says state fiscal year 25 BAA, that's the Budget Adjustment Act, but that's sort of our best estimate right now for how much we spend. That's at about 157 million. And the estimate for next year is about 167 million in the governor's budget. So it is it is close to triple what it used to be, which is pretty significant. Uh, and we can go to the next slide, I think, too, and that's my final one. And you'll hear more about this, but what we can see again is that participation has really increased significantly from previous years. We have about 42% increase in the number of children who are participating in childcare financial assistance, and we're seeing the greatest increases in terms of infant and toddler participation. So, all of the details that the Child Development team has been working on, we are seeing that play out in terms of resources to support families and to support early childhood education after school programs.
Thank you, Janet. And as we're transitioning to the Child Trends team to hear more about the data efforts and the impact that we're seeing on children and families and programs, I just want to say a quick thank you to the Child Development Division's data team because they have been working in really close partnership with everyone on the call today to both identify indicators, what data we have, get it into the state's data portal, as well as transitioning that data to team members. So thank you. Sarah and Kate, I'll turn it over to you.
Great. Thanks, Morgan. My name is Sarah Amadon, and I am a senior research scientist and program area director at Child Trends. And I am here on behalf of a much larger team, or rather, Kate and I are here on behalf of a much larger team. And we are working with CDD and Building Bright Futures and have connected with a lot of other stakeholders in Vermont to really specifically dig in to the childcare subsidy policies as related to Act 76. So Act 76 was a much broader set of initiatives and policies. And this research that we're sharing today really focuses on the initiatives focused on childcare subsidies. So next slide. And I do want to mention that this project is supported by the Administration for Children and Families in the U.S. Department of Health and Human Services. And so none of this here reflects the views or endorsement of the U.S. government. Next slide. Great. Wonderful. So as I alluded to, and as has been kind of the theme of today, is this research partnership is really a part of a broader collaboration. And our goal is to learn about how recent changes to childcare subsidies, called the Childcare Financial Assistance Program, or CFAP or CCFAP, I've heard it a few different ways, have impacted equal access to childcare in Vermont. So who's able to access childcare? How does that look different potentially after? We also are seeking to understand the perspectives of childcare providers in this initiative. So we have been developing surveys, we conducted focus groups, and we are analyzing administrative childcare data. The study is informed by ongoing feedback from families and providers and from lots of other various groups and stakeholders in the state, in addition to kind of getting national perspective as well from other research partners. Next slide. Great. So I'm going to turn it over to Kate now, who's going to share some of our findings from our focus groups.
Awesome. Thanks, Sarah. Hi, everyone. My name is Kate Stieber, and I'm a research scientist at Child Trends working with Sarah on this project. So as Sarah mentioned, we conducted a bunch of focus groups in August and September of 2024. These focus groups were with parents and caregivers with young children, as well as with early care and education administrators, which we are sort of defining as folks who are center directors at a center-based program or family child care owner operators. So looking at parents first, we spoke with 34 parents and caregivers in total. 15 of those parents were parents who are recent immigrants to the United States, immigrants or refugees, and we conducted those focus groups with those 15 parents in person with the help of translators. Among the parents that we talked to, 18 of them were currently participating in CCFAP at the time of the focus group. 2 of them had previously participated in CCFAP, but were not currently participating. And then 14 of the parents that we talked to had never participated in CCFAP before. And most of those were the folks who were the recent immigrants to the US and to Vermont. Then looking at the early care and education administrators, we spoke to 26 administrators in total. Um, 16 of those providers or administrators were center-based, and 10 of those were family childcare owner-operators. You can see a little bit more about both of these groups in the figures on the slide here. We did want to note that a majority of the administrators that we spoke to were in Chittenden County. We did speak with other administrators across the state, with the exception of which three counties? Windham, Essex, and Grand Isle counties. We were not able to meet with providers in those areas. Next slide, please. So I'm not going to spend too much time on this because we didn't talk through the policy changes in depth. But for this research project, for this research partnership, excuse me, we were interested in learning about the different impacts of recent changes to CCFAP. Some of those are shown here on this slide or in this timeline, but a few that we do want to call out during our focus groups and in our upcoming data collection, there's a few pieces of the policy that we're particularly interested in sort of hearing folks' experiences with and feedback on. So those included the increases to the reimbursement rates for providers, all providers receiving the same reimbursement rate regardless of star rating, the expanded income eligibility requirements so that more families are eligible to participate in CCFAP, the creation of a single co-payment for families or a family share payment regardless of how many children in the family are receiving care. And then the other aspect that we were interested in looking at is sort of this change where families earning up to 175% of the federal poverty level have a $0 weekly family share or copayment. Next slide, please. So let's jump into kind of sort of what we heard. This is obviously a very condensed version of the great feedback and experiences we heard, but we'll start with sort of what some of the great positive feedback that we heard about CCFAP and the recent changes. This slide has a few quotes on it that folks can take a minute to digest while I'm talking as well. But from administrators, we heard most frequently that they really appreciate how CCFAP is expanding access to childcare in Vermont by making it more affordable for more families. Many providers talked about how the increased CCFAP reimbursement rates have been essential for their programs through a variety of ways or mechanisms. So they're providing programs with financial stability. They're allowing for wage increases for staff and bonuses. They're allowing programs to provide benefits, either expanded benefits or new benefits to their staff and more. Relatedly, administrators that we spoke to in focus groups also talked about how they appreciated the predictability and the reliability of CCFAP funding and reimbursement, which really helps them plan for their sustainability and for their programming across the entire year. As you can see in this second quote, this blue quote on the bottom here, providers really noted that these increased CCFAP reimbursement rates are now more closely aligned with the true actual cost of providing childcare in Vermont. And then switching to think about or share what we heard from parents and caregivers, we heard a lot of great feedback as well. We heard overall positive experiences working with their CCFAP eligibility specialists. Parents shared examples of how the specialists helped them with their applications, answered their questions, helped them gather the needed documentation to complete their application, and just helped them facilitate the process in general. Parents also noted that CCFAP makes childcare more affordable for more families. We heard that from a lot of parents. They also talked about how lower childcare costs for their family as a result of these CCFAP changes is promoting their own family's individual or their own family's economic stability. So they were able to save more on childcare costs, which was freeing up money for other essentials like food or rent. Lastly, parents noted that CFAP has the ability to increase access to early care and education across the state of Vermont by making it more affordable. But they also shared some examples of how hard it is to find childcare slots, especially for infants and toddlers in many parts of the state where there are very few childcare providers. Next slide, please. So in that same sort of vein, we also heard from parents and caregivers and administrators about some areas for improvement related to CCFAP and the policy changes. Parents and caregivers shared, as I was sort of just alluding to on the previous slide, we did hear a lot of challenges related to finding available slots for childcare, especially in rural areas. And we do want to note that that is in no way unique to Vermont. That is a national challenge that we are seeing in, I would argue, every state across the country. We also heard some confusion from parents about what their co-payments would be given some of the changes to how the family share payments were structured, parents were a little confused who they should be paying if they had children in different programs. We also heard a few instances of providers charging fees or increased rates that were not covered by CCFAP, which some families struggled with. And then lastly, we heard some challenges related to the CCFAP application. So we heard about some language barriers, like documents not being translated into some languages that families spoke, challenges gathering the needed documentation and paperwork required for the application. We found this was especially true or challenging for parents who were self-employed, involved in agriculture work, gig work, working part-time. They especially had some challenges with the needed documentation. And then ECE administrators echoed a lot of these same challenges. The ones that we heard the most from them about were the similar family share payment confusion around how they should be handling a co-payment from a family that has children in multiple programs. They also elevated and sort of echoed the challenges parents shared related to the CCFAP application. Next slide, please. So to kind of round out some of these focus group findings, I'll talk a little bit about some of the impacts that we heard from parents and caregivers and administrators. Some of these overlap with some of the things that were shared on the previous slide, so we won't spend too much time here. But we heard about so many different positive impacts of Act 76 and these changes at the family level, the workforce level, and then the early care and education program level. So at the family level, as I was just discussing, we heard about how CCFAP and these changes is making care more affordable. More families are able to access CCFAP and receive a child care subsidy. They're able to enroll more children in their family in care or reduce or change their children from part-time to full-time. And that there was reduced stress for families because of all of this. There was freeing up money for them to spend on other essentials. And there was also increased access for immigrant and refugee communities. For the impacts at the ECE workforce level, we heard about staff receiving bonuses, staff receiving increased pay, increased salaries, receiving health insurance for the first time, dental insurance, life insurance, short-term disability, covering their paid parental leave, et cetera. So we heard a lot of great impacts for staff as a result of Act 76 and likely as a result of the increased reimbursement rates for programs. And then at the program level, we heard, as I kind of mentioned, that programs they had more stable enrollment and had more reliable, stable funding that allowed them to plan and feel like their program was sustainable longer term. So now I will hand it back to Sarah to walk through some admin data.
Great. Thanks, Kate. So yeah, I'm going to share a few slides that are kind of similar to the ones that Janet showed us, looking into the number of families served and then the number of slots too. And I should note, we focus on the period from about September 2020 through the end of September 2024. So we've not yet added on that last quarter here. But as Janet kind of showed us already, that the number of families receiving subsidies in Vermont really has increased just dramatically and dramatically over a very short period of time. Next slide, please. Now, importantly, when we think about the number of people receiving subsidies, we want to make sure there's a kind of a corresponding increase in slots or the availability of providers, of classroom spaces, if you will. And we do see here, specifically from January 2024 through September 2024, there has been a corresponding increase in slots over that period. So about a 1.5% increase of the slots over this period. Next slide. Great. And then we can look at that by ages of children. And so similarly, we see for infant toddler care, really a kind of the biggest increase over this period of time. So if we look at that period of January 2024 through September, we do see that really solid uptick over that period of time. And then one last slide. Great. So this is then preschool and school age. So we do see the smallest increase in slots for preschool age, and a small increase, but not quite as small as the preschool increase for school age. And I couldn't agree more. I think Morgan spoke to how terrific it is working with the data team at CDD, and we've had such a great experience. We couldn't thank that team more for helping us get to know these data and successfully analyzing them. So that's our first snapshot of our administrative data analyses. But in the last slide, we want to talk a little bit about our next steps. And they include, as I alluded to, a parent survey, a provider survey, and ongoing analyses of administrative data from CDD to look at the receipt of the increases in subsidies for families who receives them, and then also corresponding changes for providers. And we have some sample research questions here too that are just, again, a sampling of a much longer set of research questions we hope to dig into over the next 3 years. And that includes, to what extent do families' childcare arrangements align with their needs and preferences? So we are very excited. We have a parent survey that is currently drafted and we hope to field early summer. Similarly, we want to ask, how are policy changes contributing to the changes in the demographic characteristics of children and families who are accessing childcare subsidies, to really look and see who and also where these families are receiving them. And then for providers, we're excited to ask, are more providers opening and more providers participating in CCFAP following these policy changes? And again, are some parts of the state impacted more than others, to make sure, again, getting back to kind of issues in rural supply of childcare. And then finally, how have increased reimbursement rates and capacity payments helped offset providers' costs? So we were, as Kate alluded to, we heard from our focus groups that the providers, the administrators are able to really offer more to the workforce, for example, and we really want to dig into more in our provider analyses, what providers are saying they are able to do with these additional funds. So again, this is just a sampling. We have a lot of exciting work that we're looking at doing and excited to share a lot of these findings as well via a few other mechanisms as well. And so we will turn it back over to Morgan.
Thank you, Sarah and Kate. And so for those of you who are on the call that are family members or early childhood education providers, we also wanted to make sure that you knew what work was happening behind the scenes in the monitoring and how you can be more engaged. So we do have Sarah and Kate's information here, and be on the lookout for these surveys that we're going to be putting out, because again, we're seeing this as our collective responsibility to understand what's working and what's not on behalf of kids and families and system partners. All right, let's transition to the Executive Director of Vermont AYC, Sharon Harrington. And as we do that, I just want to do a brief reminder. Please be providing any of your questions and comments in the chat. Appreciate Becca's comment around the importance of actually hearing from the voices of those most impacted. Go ahead, Sharon.
Thanks, Morgan. My name is Sharon Harrington, and as Morgan just shared, I'm the Executive Director for the Vermont Association for the Education of Young Children, which we fondly call Vermont AUIC to save a few syllables there. I'm the proud Mimi of a 4-year-old granddaughter and a 1.5-year-old grandson, and their parents are incredibly appreciative for Act 76 and expanded CCFAP eligibility and the investments in childcare. Vermont AUIC is the largest membership organization for early childhood educators in the state. Our mission is to advance equity and excellence in early childhood education with early childhood educators as our foundation. We are the state affiliate of the National Association for the Education of Young Children, NAEYC, which promotes high quality early learning for each and every child birth through age 8 by connecting practice, policy, and research. Our members tell us what they need, and we strive to be a unified voice advocating on their behalf. We thrive in partnership, as you will hear as we go through the slide deck. And if you'd like to learn more about our organization and our initiatives and our membership benefits, you can visit our website at vermontauic.org. As we heard from Kate and Janet and others, investments from Act 76 are making a difference. Childcare is more affordable for more families, making it more accessible, and early childhood programs are more stable. The success of Act 76 is dependent upon recruiting and retaining the early childhood educator workforce to ensure childcare programs are able to staff all classrooms to serve all the families that need it. While many educators have seen increases in pay, which we've just heard, due to increased CCFAP funding, not all have. Pay increases are not yet mandated, but we expected a staged, phased-in approach through this whole process of Act 76, initially stabilizing programs, ensuring affordability for family, improvements in childcare quality, and now we're really focusing on addressing workforce system change. Act 76 sets the stage for that, and it's dependent on carrying out the system change for our workforce. That's because expanded program capacity really relies on having an adequate, well-prepared, well-compensated early childhood educator workforce and early childhood educator profession. Getting the investment in the system was the essential step to pursuing early childhood education as a recognized profession in Vermont. We needed to make sure that compensation was moving in a positive direction, programs were stable, and we're starting to see that investment making a difference. Act 76 includes intent language about workforce compensation. By January 1st, 2026, the Vermont Department of Labor must submit wage level estimates for early childhood educators. But to ensure fair wages, we need a consistent framework for qualifications, responsibilities, and scope of practice and accountability. We're threading the needle to ensure that compensation increases align with increased qualifications. While better compensation is crucial, we must support our workforce before increasing qualifications. Recognizing low wages has historically been a barrier. Legislators and CDD have invested in numerous programs to retain and prepare early childhood educators and to incentivize increasing credentials. I'm going to provide some data about those programs that is in the time frame from July 2023, when Act 76 began rolling out, to present. And there are several slides that will illustrate the resources and supports that are embedded in the system, and I'll move through them fairly quickly. The first one is the Student Loan Repayment Assistance Program. This was established in 2021 through Act 45, and it was extended beyond 2026 due to Act 76. This program has provided nearly $1.18 million in relief to 133 educators, covering 26% of their combined student loan debt. Next slide, thank you. There have been a lot of changes in the system, and those of you that are actively working in the field can remember navigating all the changes and the staged rollout of Act 76, and concurrent to the Child Development Division's launch of the STARS revision, SPARKS, System for Program Access to Resources for Quality Supports, another easy one that just rolls off your tongue, launched in 2023. The CDD initiative is administered by Vermont AUIC in partnership with Vermont After School to support a culture of quality in childcare programs. SPARKS has three main components: quality coaching and support services, program assessments for Vermont's revised Step Ahead Recognition System, STARS, and administration and support for Vermont's early childhood networks. SPARKS has had a profound impact with 282 assessments completed, more than 1,000 coaching engagements, 218 professional development sessions attended by 3,800 participants. So this is the supports in the system that have really made a difference in supporting quality improvements and folks to engage in all of the things that they're navigating with all these changes. And one of the especially exciting things is that 80% of programs that improve their STARS rating have worked with SPARKS. We can't quantify this, but we hear repeatedly that programs may not have continued engaging with STARS after the revision if they hadn't had access to SPARKS. So many of us know research has demonstrated the value of peer professional networks, and Vermont has a long history of peer networks. Historically, it used to be called Starting Points. Now it's called the Vermont Early Childhood Networks. These professional peer networks have existed in various forms over the years, and access was somewhat dependent on where you were located or what role you held. Here we are a year later after Vermont AUIC started administering these networks, and every region has an inclusive professional peer network. As we also have 4 statewide virtual networks for specific roles, and each regional network has an established action plan that guides their activities. So we're sort of continuing the quality improvement that starts in a program into a regional and statewide networks. A leadership academy specifically for aspiring network leaders will be offered later this year. Another huge investment is the professional development grants and bonuses. Vermont AYC administers these for CDD, and this funding goes directly to the field. So it's essentially passed through Vermont AYC. These grants reduce financial barriers, helping our workforce stay on track to earn credentials, and bonuses provide incentives for achieving credentials. There are also program grants and bonuses that incentivize continuous quality improvement. And you can see, the financials related to those particular supports. We also have a long history of supporting career advancement for our early childhood education workforce. Vermont recently celebrated 10 years of Teach scholarships, and we also administer a registered early childhood apprenticeship program. And these are some of the statistics related to scholarships awarded, number of graduates, how many courses have been funded during this time frame, and some of those scholarships and supports. So even though we're continuing experiencing a workforce crisis, Vermont AYC has been focused on clear professional pathways for those who are interested in a career as an early childhood educator. Our youth apprenticeship program is fully enrolled, and interest continues to grow. This is one of the most exciting things that I think we have when we're talking about the workforce crisis. We're collaborating with 9 high school career technical education programs. And these high school students are earning college credits that can be applied toward a Vermont Registered Apprenticeship Program, the ECE Apprenticeship Program, or translate into a degree program. And it also provides important experiential learning while they're being mentored in early childhood programs. Often these students are hired after graduation, so those partner childcare programs that are supporting their mentorship are growing their own workforce through this model. So this is the impact we've seen since Act 76 was implemented. Now I'm going to go back a little bit towards what I referenced when I was talking about the workforce system change and what's next. When early childhood educators are respected, paid fairly, and see a future in their careers, we can recruit and retain them. We know that there are lots of people who would choose to be in this field, but due to all of the other barriers are unable to remain here. So we believe that formally recognizing early childhood educators as a profession is a way to move through this. So last spring, Vermont AYC submitted a request to the Vermont Office of Professional Regulation, OPR, on behalf of thousands of early educators who participated in Vermont's Advancing Early Childhood Education as a Profession, which is a workforce-led initiative to request that the office conduct a sunrise review to independently assess whether early childhood education should become a recognized profession in Vermont. In January, OPR released their sunrise review report to the legislature, recommending professional recognition for early childhood educators in line with the National Early Childhood Educator License to Practice designations of ECE 1, 2, and 3. OPR has been working with legislators to turn their recommendations, which align with Vermont AYC's recommendations, which came directly from the workforce, into a bill. We know that the top indicator of quality in a young child's early experiences is the qualifications of their educator. Investing in educators means investing in children's best outcomes. And that's the system change that we're seeking. Individual licensure to practice is a framework for clarifying qualifications, the responsibilities, the scope, accountability, and compensation for educators who are well equipped to provide safe, quality care for children. Since 2018, early childhood educators across Vermont have led this visionary work. We have a task force and a core team that represents the diverse regions and settings, both family childcare, center-based, public school, systems folks, and have been gathering input from thousands of peers. Their recommendations were submitted to OPR, and that is, we now have this companion bill. We have a companion bill, one in the House and one in the Senate, that are based on OPR's recommendations. And they fully align with what the workforce vision was and national standards. So it's very exciting. So just as Act 76 had this phased out staged rollout, so will the transition to licensure to practice if that is what's recommended. OPR's report recommends a multi-year transitional license for current educators, protecting retention while strengthening the system. Nobody wants anyone to find this to be a barrier or to lose any early childhood educators that we currently have. And that's one of the reasons why I highlighted all of the supports within our system already to prepare us for this moment. This sets us up for a future system where early childhood education is a desirable career with career mobility and advancement, while also honoring the knowledge and expertise of the current workforce. So Vermont is leading the way in early childhood education transformation in all the ways we've talked about. And over the last few years, we have stabilized programs, expanded workforce supports, and are now ready for this next step, establishing a recognized profession. Thank you.
Thank you, Sharon. And I appreciate the questions coming through in the chat. I see that our panelists are starting to respond to them. Just a reminder, we will still do that question and answer at the end. And let's transition to Erin Roach, who is the Executive Director for First Children's Finance, to hear about more work happening for childcare businesses.
Thanks, Morgan. And thanks for having me here today. It's always a little nervous when the sponsor tells you you're the last of 4 expert panelists, what you're going to say. I'm relieved to note that themes in what I'm going to talk about really echo themes that Janet, Kate, Sarah, and Sharon all talked about. So I feel like we're all kind of telling a consistent story, but from a little bit different angle. Next slide. Also, recognizing that I'm last, I'm going to just go through these because as rapidly as I think makes sense, because I think you've heard a lot of information in the past hour. So First Children's Finance here in Vermont, I just want to be really clear. We're not a research company. We're not here monitoring Act 76 per se. First Children's Finance has a mission to increase the supply and business sustainability of excellent childcare. We do that by working directly with childcare businesses, by working with communities, and by working at a systems level in the states where we operate. In Vermont, what that looks like is we provide business technical assistance to childcare businesses. We also provide access to capital for childcare businesses. We do some work with communities that are interested in more childcare in their community. We also do some work supporting our childcare system at the state level. So that's what we do in Vermont. And so what I'm going to, thank you. What I'm going to do today is share a few different, kind of weave together some different sources of data. And like I said, this is really part of the work that we do in Vermont. It's not a specific research project. So all the data that I'm going to talk about, we will continue to keep tracking and analyzing over time, as long as we're doing this work here in Vermont. Since we're fairly new, we just celebrated our 2nd birthday for Vermont. I thought I'd show you who we are. There's 7 of us. 5 of the 7 work directly with childcare businesses in Vermont, and the other 2 of us do things like I'm doing right now. So that's who we are. Anyway, excited to be here. You can go to the next slide. Okay, now I'm going to show sort of rapid fire some state administrative data, not the same as what Sarah shared earlier, but related and from the same data source. So you can go to the next slide. main reason why I wanted to bring this today is that I've been lucky enough to be capturing this data and kind of continuing to update it for a number of years now, as you can see. And I just wanted you to see this is just the number of regulated early care providers from 2011 through the end of 2024. I wanted you to be able to like put kind of the numbers that Sarah showed earlier about the trajectory since 2020 in some like bigger context. And so you can kind of see that 15 years ago, we had a lot more childcare providers than we do right now. But you can also, if you look really carefully at the last year, year and a half, you can see that that the numbers start to tick up a little bit. I'm not going to talk about capacity here today because I think that Sarah did that earlier, but I just want to say that capacity has generally trended in a similar way. However, we have experienced consolidation in the industry. So capacity hasn't declined as much as the number of providers. So you can go to the next slide. This in 2023, we started adding after-school programs, so all regulated childcare into this number. So I don't have this going back to 2011, but I just wanted you to get a sense. And going forward, this is really what we'll be looking at. So you can see different kinds of programs and how they've either increased or decreased over time. And you can see family childcare trends a little bit differently than centers and after-school programs. Okay, next slide. The slide that I have come to really appreciate more than I used to. We've been tracking the early care information about how many programs have opened and how many programs have closed. We started doing that in 2018. And I didn't used to love this because you can see that the green line is the number of programs that closed each year, and the blue line is the number that opened. It was always really a stark reality that we were looking at, and that was just hard for me to see. So in this year, however, 2024, we experienced for the first time more programs opening than closing over an entire year. We also noted that that happened every single quarter last year, more programs opened than closed. And while we don't have the sort of official quarterly counts yet, just looking back on a weekly basis, we think so far this year, January through mid-March, that 13 programs have opened and 6 have closed. And if you go to the next slide, oh, one more, sorry. Yeah, we're all good. I just was going to point out the percentage of programs closing each year has also dropped, and it's dropped twice, right? Once in 2018, where kind of some investments started being made in building capacity, and then again in 2024 with Act 76. So thank you. Go ahead. And again, in 2023, we started tracking all regulated programs, not just early care programs. And so this is, it's not as exciting to look at because we don't have very much data, but it tracks a similar trend. And so I just wanted to make sure that I shared that with you all. So we can go to the next slide. So one of the things that First Children's Finance does in Vermont every year, we conduct a survey of all regulated childcare businesses in the state. And we finished collecting that survey data on March 14th, I believe. So I had about a week to look at what the data was before today. So this is very preliminary and almost literally hot off the press. So anyway, I just brought a little bit of data. I think it's really interesting. And all the questions that we ask are about childcare businesses and sort of the stability of their business and kind of how they're feeling about their business. So we can go to the next slide. This is who we talked to. We got responses from 219 regulated childcare businesses, providers in the state. That's about 20% of the number of regulated programs in the state. And you can see I broke it down by the types of programs. So you could get a sense. Just a fun fact, this is the third year we've collected this data and conducted this survey. And the 2 previous years, we had just over 100 responses. This year, we worked really hard at it and encouraged people to participate. And we've gotten to know a lot more of the child cares in the state, and we were able to just about double participation. So we are feeling really, really proud of that, and really good about the response that we got. And you can see we had at least one response from every county in the state, which feels like something also to be proud of. So you can keep going. Thank you. Oh, that's hard to see. I'm really sorry. Shall try to narrate this slide. So this is a question we asked about compare in 2024 we asked, and that's what the blue bar is, and in 2025 we asked, and that's what the green bar is. We asked people how stable your business is compared to the previous year or previous years. And the tall bar, which is between 50 and 60% there, is the answer. Last year, my business was about the same as in previous years. The middle one is last year, my business was less stable than in previous years. And the one furthest on the right is last year, my business was more stable than in previous years. So I wanted you to see this because this issue, and I think Kate brought this up earlier, this issue of stability is really important, right? It's really important in business and honestly in life for things to be stable and predictable, to be able to make more investments, to be able to grow capacity, to be able to do more things. You first need to come from a sort of base of stability and predictability. And so seeing more than half of the people say that their business is about the same as last year, or it's more stable than it was last year is just really important basis for everything going forward. And we'll see how the rest of these slides go. Sorry, I have to narrate all of them, but go ahead. Here we go. Oh, it's much better. Okay, this graph is the percent that reported stable enrollment for the previous year. So they had a choice. They could say their enrollment decreased, their enrollment increased, or it remained stable. So this is the percentage. And like I said, this is the 3rd year we've done the survey. So the first column on the left is the first year, 40% said that they described their enrollment as stable. Last year, when we asked the question about the year before, 57%, remember this was just after Act 76 was starting to be enacted, 57% said that their enrollment was stable. And then this year, we asked people to reflect back on the previous year, and 64% said that their enrollment was stable. So I think that, again, that's sort of helpful context for what we think the impact of Act 76 and the sort of public investment that's being made is having, whether it's on the ability for families to pay or whether it's on the sort of stable revenue through CCFAP. We think that it is creating an environment of increased stability for these businesses. Next slide. Thank you. So hiring, and Sharon talked for a while about the workforce and how Act 76 is having some positive impacts on workforce and like related issues like compensation. So I wanted you all to see. So we've asked this question 3 times over 3 years. The green bar is the first year, the blue bar is the second year, which was just after Act 76 and readiness payments had been made, but eligibility hadn't increased. And the last bar was asked just in the past month, but we were asking them to reflect back over the previous year. So I just think it's really notable that that very or somewhat difficult time in hiring people has continued to decline. I mean, it's still roughly 2/3 saying that hiring is difficult. But the fact that people in that middle cluster are saying they're either not hiring or they're sort of neutral on how difficult hiring is, that increasing to 1 in 5. I think those 2 things taken together are just really suggestive of when you're able to, when you have a more stable basis for your business, when your revenues cover your costs, you're able to pay more, you're able to compensate people more, either through benefits or through wages or both. That translates into hiring being easier. At the same time, when the message out there is that the state thinks childcare and is really important enough to make $125 million a year public investment, then people start to think maybe that's an industry, a career that they want to work in. So I think those two things are conspiring to improve the hiring picture, although it is still not easy by any stretch. You can go to the next slide. Right, this is a little chaotic, and I'm sorry, but I thought it was really important to bring a couple more facts. So we asked them about how long they plan to stay in business. The numbers that you see, the blue and the orange bars, the blue bars are centers and after school programs. Sorry, I have that reversed. The blue bars are family childcare and the orange bars are centers and after school. I just wanted to note that that the percentage of indefinitely has remained fairly constant. Some decline in the centers and after school. I think it's interesting that the percent that said that they're unsure has declined from last year. So I guess I would take that back to that idea of stability and predictability in this industry. If less people are feeling unsure about how long they can stay in business, then that means that's more stable experience for families. That's probably means that they're feeling more stable and predictable in their lives. One more point I'll make here is that 17% of family childcare said that they expect to be in business for another year or two. I think that's notable, and I think that it continues to reflect, and it reflects an increase of people who are getting ready to retire. Anecdotally, as I was looking through the data and kind of pulling these numbers, most, don't quote me, but it seemed like most people that were saying they didn't expect to stay in business more than a year or two were saying it was because they plan to retire, or some similar sort of answer. So I think that is really important, right? That open and close rate, that rate of programs closing is really important for us to keep investing in new programs, keep making this a desirable field, a desirable profession, because we need to replace people who are ready to move on to something else or ready to kind of make a really big change in their life. Okay, next slide. Okay, just a couple more slides. I wanted to add in just a little more context. So some of my colleagues at First Children's Finance have been working with the state of Vermont on a cost of care report. And so I wanted to bring a couple of pieces of data from that report. I think it's really useful to share here because I think that Act 76 and CCFAP reimbursement rates and the expectation that so many more families will be using CCFAP to pay for their childcare has real implications on whether programs are able to cover their costs. And like I said, my theme is all about predictability and stability. And I think that I think some of this data points out where things are stable and predictable and where they might not be, and there might be work still to be done. So you can go to the next slide. I'll also say that this is not the focus of my presentation. I just thought it was helpful context. I'd be happy to put, if you have questions about this, happy to put you in touch with the authors of the report for more information. So there's a lot here. I'll just summarize by saying that CCFAP mostly doesn't cover the cost of caring for infants and toddlers, and that the revenue that comes in from preschool often subsidizes infant and toddler care. And I think that has implications for some of the thinking Janet referenced earlier about pre-K and the future of pre-K. I think that that understanding has implications for some of those decisions. I also wanted to note that the exception to that is family childcare homes. And I think for a long time, there's been an assumption of moving towards more center-based care, or somehow that family child carers weren't providing the same level of care, or something like that. I think that family child carers are, because of Act 76, they are not suddenly, they are able to provide really quality care to children, and they're able to do that in a sort of cost-effective and stable way. And so I wanted to point that out, that just think that's important to note. When we think about scale, a lot of times as an economist, we think about scale. A lot of times we think bigger is better. And I think that's just not the case. And you can see that here. You could go to the next slide before Morgan gives me the hook. Yeah, so just one more slide about cost of care and the difference in different sizes of programs. And then you can go to my last slide and I'll be done. So just a couple of things to wrap things up. I think I've said this a few times. It seems from all of this data that childcare businesses have entered a kind of more stable operating environment, and that feels really important. We think we're seeing that entrepreneurs see opportunities to start childcare businesses, right? That you can see that in the open rates. We also think that more people who are highly educated are choosing to be childcare providers, which is just a really important note, especially as we consider some of the legislation that Sharon was talking about. Hiring and the cost of compensation continues to be a challenge. And what I just said about the cost of infant and toddler care being subsidized by preschool. So those are just my reflections for all of you. That's it. Thank you.
Thank you, Erin. All right, so we've pulled out our slide share. I want to invite everybody to come back into the space. If you're State Advisory Council member or not, we invite you to turn your cameras on. You know, that first part of our presentation today was supposed to be around 10-minute work in progress presentations on behalf of some of our critical partners that are doing exceptional work in this area, letting you get to know them and hearing about their role in the system, but also what they're tracking. And I think one of the things that you heard from some of those partners is that data collection and tracking is taking place across so many different entities based on their discrete role in the system, and is not necessarily tied to the law itself, but is a part of their broad responsibilities and how we think about our discrete roles. So from a monitoring perspective, BBF's role is to bring those partners together and the data together to help inform our understanding of what's happening. I think one of the things that I'd love for folks to touch on first is that, you know, there are several programs that were referenced in each of your presentations and also in the chat through questions that we didn't dive into today, like after school and out of school time care, pre-K, special accommodations grants, children's integrated services, right? There are so many other interconnected pieces. So I'd love to start just talking a little bit about Amber's question. What do we not yet fully know about Vermont's childcare and early childhood education system, and what data, panelists, do you feel like is most important and powerful in understanding families' experiences, the industry of childcare, or the needs of early childhood educators, especially thinking about children with disabilities and special healthcare needs, from Amber's questions in the chat?
Well, go ahead, Janet.
I think maybe focus on the second part of the question, specifically related to children with disabilities. Because I think, but I guess my answer to the first part of the question is something that I always wonder about, right, is around the demand for childcare and what are the childcare arrangements that parents truly prefer. And it's recognizing that everybody's family structure, you know, their kids' needs, their work needs, they're all different. And so just trying to figure, you know, it's very tricky to, and everybody's so used to having constrained choices. I mean, it's going to be constrained at some level, right? But that it is difficult to gather the data on what would families do if they truly had choices. But I think hopefully we'll be getting to a place where we can begin to see that based on the choices that families make in terms of the kind of care that they're getting, in terms of the hours of care that they're saying that they need. When it comes to support for children with disabilities, I do want to say that we have our special accommodation grants, which is something that the Child Development Division offers in partnership with as part of our sort of a combination between our Children's Integrated Services Program and our Child Care Financial Assistance Program. And it's funds to support the safe inclusion of children who have some additional needs to be included in a community-based program. And, thanks to, honestly, through the American Rescue Plan funds, and then right now through the Preschool Development Grant funds, we have been we've been able to really increase the amount of money that's available for that program, which is really helping us to actually assess demand in a way that we couldn't before, because before we were so limited by the amount of dollars that we had available. The grants were really small, the time frame was small, the amount of money we were able to request was really small. And so we didn't have a true picture of what the need is. And I think with some of the additional resources, we've been able to see what that need is. And so it's closer to, not $300,000 a year or $600,000 a year. It's a couple $1 million a year at least to make sure those kids are included. And then we also have a new opportunity in front of us with the Federal Child Care Development Fund, is asking us to think differently about how we are supporting children with disabilities and their inclusion within early care and after school programs. And that's something that over the course of the next 15 months or so, we're going to be looking at rolling out a different way to be able to support those children with sort of thinking about what's the best we have from child care financial assistance and the best thinking from special accommodation grants, and thinking about how we can blend that.
Erin or Sarah, anything you'd add?
I was actually gonna make the same point that Janet made about understanding sort of families' needs and demands for childcare, and like where it is and how it is and when it is and what they mean by full time, which I feel like schools define that one way, parents maybe define it somewhere else, and right, and there's every possibility in between. And I think really understanding what families need in all the ways is really important. The second thing I've been thinking a lot about is eligibility for CCFAP has expanded greatly, and I think the state has done some amazing changes where they could make some changes in eligibility outside of income based. And I know a few years ago we made some estimates of how many families we thought maybe would now be eligible. I have no idea what the truth of that is, and I would love to better understand how many families can access childcare financial assistance to pay for childcare, and if they're not, then who are the categories, who are the groups of people that it's not working for? And so that would be my second thing that I don't know that I would really like to know.
Yeah, and just to close the loop, yes, these are such great questions, and they are things that are currently on our survey slated to be launched in early summer. So what will be critical there, and I will just to put a pin in this or to emphasize this, is to get as many parents as we can to respond. So that will be one of our real goals, is to make sure that parents receiving CCFAP, and Erin, to your point, parents who may be eligible, who may be opting out, we really want to understand needs, preferences, eligibility in the process, and really trying to put together a picture to help, and to ask about, children's special needs and the children's characteristics as well, to hear how the children with special health care needs or other, factors might be related to their own care. So yes, hoping to contribute to that.
Thanks, Sarah. I'm looking at some of the other questions in the chat that sparked a ton of discussion, and we only have about 4 minutes left. So I just want to quickly name that one of the things that sparked the most discussion was how families know that they qualify for expanded subsidy. How are we doing this as a state? How do we how do we standardize this information going out? And is there some sort of strategy that we're seeing that might maximize benefit uptake? So I know that there was a bunch of discussion. If any of our SAC members or panelists want to jump in and just name a couple of those pieces or how you're thinking about it before we wrap in the next 2 minutes. Janet, if you want to talk just briefly about the communications campaign, and then I can mention a couple other.
Sure, I'm happy to. From the Child Development Division's perspective, we have sort of doing a staged outreach and communication campaign, certainly really relying upon our partners. The research that we have from Child Trends, affirmed the fact that from a couple of years ago, affirmed the fact that the main way that parents hear about childcare financial assistance is through their childcare providers, which makes great sense. We wanted to make sure they had really good information. And we've been doing they had good information and doing press releases, trying to do some earned media. But we're really excited that at the end of January, we were able to launch some paid media. So maybe some of you have seen that or heard that out in the world. We just recently, last week, got out posters and brochures to be able to a variety of different places where families with young children or school-age children often are. So trying to make sure we get the resources out to folks. And we have a digital toolkit as well for people that want to include it in their own social media or newsletters too.
Thanks, Janet. All right, so we only have 2 minutes left, and we're not going to get to every single question. I do want to name that I'm seeing questions come through about rates paid to programs and the varying hours. There are a lot of questions about how any of the impacts federally will be impacting our families who are funded with CCDF and CCFAP. So just naming that as you are thinking about questions, as you are communicating with families or programs who have questions, we're happy to relay those to the partners and the colleagues that are on the call today, and also think about how we answer those questions if we aren't currently collecting that data. Because one of the other things that we're really looking to do over the next 10 years is say, okay, what are the most important things for us to understand about this program? So the more questions you're asking, the more we can consider in terms of how we are asking questions of families, of programs, and what we need to be monitoring. So in this last minute, I just want to say thank you so much and sincerest appreciation for all of the incredible work of the partners that are on this call across their respective sectors to both implement Act 76, for those of you who are building the capacity of the state to either implement critical programs or infrastructure, and those who are in a space to help ask key questions and to monitor the impact of these efforts. So there will still be a lot of work happening. We invite you to be involved and send us your questions so that we are building that list and monitoring the system together over the next couple of years. Thank you so much for being here for Early Childhood Grand Rounds on Act 76 and our State Advisory Council meeting for March. We'll see you next month.